Hi, I'm Dr. Ivan Puah, and I founded Amaris B clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. I've been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for visceral liposuction, and Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift, and also under Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. We're going to discuss about some facts and certain myths about fat grafting. I'll try to list out perhaps 10 of those that we can discuss from there on. We can transfer fats from anywhere with excess fat pockets to any parts of our body, even with the hands, which is correct. Fats can be transferred from anywhere which is in excess to any part which needs them. For example, as long as you have certain amount of fat layers on your body, even your arms, the shoulders, the back, and if we can harvest sufficient enough fats to produce or deliver the results we want, be it augmentations or be it corrective effect, then it can be used on any parts of the body and face as well. For example, one of the most underappreciated areas for fat grafting is to the hands, the dorsum of the hands. Some patients are very conscious or they don't like how the hands look with veiny, scrawny, tendon-like appearance. And we can use fat to kind of like add the areas to make it soft, smooth, supple. And the results are pretty decent and pretty predictable as well. So you'd be surprised where your fats can be harvested from and where it can be used. That's number two. How good the results from fat grafting? It really depends on the quality of the fats, where it's harvested from, and of course, the technique and the skills and experience of the doctors. The way that the fat is harvested is that we need to ensure that the fats are not traumatized or injured during harvesting. So we have to be very delicate in the way we harvest the fats and prepare them. And of course, when we are trying to graft it to intended area, certain techniques and care has to be taken to make sure that they are delicately layered in certain ways that ensure the survival of the results. The next one, number three, fat grafting is more than just a copy and a paste kind of surgery. It's a work of art. Well, anything that requires fat manipulation, be it removal of fat or grafting of fats, it's a work of art. A lot of experience and skills are required to know how much fat is removed from where, how much to be left behind. And once you have the fat and how we're going to put it, it's like doing a sculpture, doing painting. To create a masterpiece. So it depends a lot on the operator or in a way the doctor that's doing it. Next, you often see the statement of fat injections works better or worse than dermal fillers on the face. Well, it's very complicated because in certain condition or in certain things, fat grafting actually produces good results. While in other stuff, like for example, very delicate, very precise work on the face may sometimes be more advantageous to use fillers. So it really depends on the condition. I'll give you a good example. Fillers are very good for precision work, which is non-invasive, minimal downtime, and it can be done very quickly. So sometimes we use it to correct certain folds, like the laughing lines, the Meredith lines, so on and so forth. They can be very effective, very fast, and very safe. But however, let's say for someone who has a very gaunt and skinny face with a lot of volume deficient, fat grafting can be useful, especially on areas such as the forehead or temple, where results are more comprehensive, more natural, and it can produce a better looking, rejuvenated face. So this just shows us how different it is for different applications. Well, next, fat grafting, it's great in creating volume. Very right, because volume replacements with fillers or synthetic materials can be very expensive. Just imagine using dermal fillers, and every filler comes in a syringe of 1 mil, and it costs you hundreds of dollars for each mil of injections. Imagine for volume replacement for someone who requires a lot, it could cost a lot, and the results may last for about a year or even lesser. Fat grafting, on the other hand, allows us to use a higher volume because we can harvest desired amount of fats from your body to do volume replacements or the entire face at much lower cost, which may even last longer than what fillers can offer us. Well, number six, is fat grafting a more popular treatment to replace volume loss and counter aging in Singapore? Not really, because synthetic fillers are more popular and more common in Singapore for doctors and patients to treat volume replacements. Fat grafting, it's a niche treatment for certain doctors because of the complexities that this technique requires, and of course, certain issues that patients have to deal with as well. So it's for certain patients that with certain conditions under experienced doctors that it will benefit them. Well, the next statement is like, is fat grafting not done in the name of vanity, but also for confidence of restoration? Or like the previous statement I mentioned earlier on, fat grafting is very useful if it's used or done correctly for rejuvenations, for volume restorations, even for anti-aging effects. So for suitable patients, it can be very, very useful, not just for correcting volume replacements, but also to correct any kind of deficiency in scars and so on and so forth. The next I'm going to talk about is fat grafting for buttocks, for perk bumps. It is not a common request in Singapore or in most Asian countries for perkier and fuller buttocks compared to maybe in the Western spheres or even in the Latin American countries. I guess because I think most Asian ladies are not really putting a lot of attention in having perkier bumps. There are some who do, and fat grafting is actually a great tool for doctors and patients to kind of enhance and produce natural-looking buttock, which lasts for a good amount of time if it's done correctly. Next, fat is often talked about in some circles, some doctors, as an ideal filler for rejuvenation and enhancements. Fat can be very useful if it's done correctly. For certain patients, fat actually gives them a really good option to make them look younger, rejuvenated with anti-aging treatments, but they're not for everyone. And last thing that I want to touch upon is that, is it true that not all doctors can perform fat grafting procedures? Yes, it is true, because there are certain regulatory requirements in Singapore on who can perform fat grafting procedures. So unless the doctors are certified to be qualified to do fat grafting procedures and liposuctions and such, they are not allowed to perform this procedure. Thank you for listening. If you have any questions, just email us. See you again.